Hi, Dr. Anita Haque, your chiropractic coach and mentor to help you achieve unbelievable levels of success in your own chiropractic career so you can help thousands and thousands of people without drugs and surgery. I had a question the other day from a chiropractic student asking me a little bit about lower back adjustments. And sometimes adjusting the lower back, especially based on your own frame, and I'm a small framed person, can be challenging. So I wanted to share some tips with you to help you get better with your adjustments and help more people get out of the low back pain syndrome, because you and I know there are thousands and thousands and millions of people who suffer with low back pain every single day. So a couple of tips. Sometimes you'll realize as patients come in for treatment, they're not going to get better necessarily overnight, because you have to remind them, if it's been there for 20 years, it's not going to take one adjustment to get rid of all the problems. If there's arthritis in there, that could slow down the recovery. And also, if that patient is getting adjusted and as soon as they leave here, they're doing things to re-irritate, re-injure because of their job, because they're sitting all day long, that's going to affect their progress. So you want to keep that in the forefront, not only of your mind, but explaining that to the patient, because then they might want to modify some of the things that they do in their lifestyle. Okay, so first off, when I do a lower back, especially when someone has significant complaints, and it's just, I'm talking general low back pain without giving you a specific diagnosis. We're gonna just call it a subluxation, where a bone is out of place, okay? Just for demonstration purposes. So what I like to do to really help with the lower back to get a better adjustment is to start by tractioning the lower back. And simple way to do it is I have my palm of my hand, I'm actually going right on the base of the sacrum. And that's just gonna help to allow me to kind of open up the L4, L5, which is where really, the disc gets smushed the most. So as I stretch her out, I'm letting her breathe and going with her breath. How you doing over here? You okay?
Great.
Good. See, it should feel good. Usually this helps the patient to relax a little bit more, which is going to allow you to get in there and get a better adjustment for them too. Okay, so a few seconds, it doesn't have to take long. If you don't have a drop table, that's okay. You don't have to do this part, but if you have a drop table, sometimes doing a drop right on that sacral base, if they have problems at L4, L5, can be huge in just getting things to release. So we'll do a little drop. It's gonna feel good. It's very low pressure for not only the patient, but also on the doc. And then now I'm gonna set her up for a good release at that L4, L5 junction. So go ahead and lay on your side facing me. And I always like to put the patient in the most comfortable position I can for them. All right, I think I'm like getting caught up. I'm stuck. Okay, so what I mean by that is I like to take their arms. I have usually one hand on top here. I don't like to put my hand on the shoulder because sometimes it can slip down and you can get into a gray area you don't want to get into. I also like to make sure that sometimes the bottom knee is bent, which can make the lower back a little bit more comfortable and actually relaxed. I like to bring her hip out to the edge. This is all about leverage. I practice more with a side posture that's a kick move, just because of the status of my body, okay? And you want to protect your own body. I'm going to place my hands right on the segments that I want to adjust, get my leg right up on there, and boom, it's just going to be very, very quick, okay? So I'm like bending over because I'm caught here, but you want to practice these adjustments, practice on other people you care about. Be careful. You'll see how when she's in this position, you can straighten this out a little bit more. And when she's here, I'm going to have your lower hip come out. So you kind of want them a little bit more halfway on their back, on the side. You don't want to do too much torque, and if you want to get rid of the torque, you make sure their head's focused that way. This hand will go on top, and this is how you want to set up the patient. I hope you guys try this, get better at it. Send me your questions, Dr. Haque.